Hi everyone. Good morning, good afternoon, and good evening. All my dear co-learners from whichever part of the world you are all joining. Today we are having session 2 on Eastern Mediterranean Climate and Health Responders course, where we are going to be talking about the degraded air quality and the impacts of air pollution on the human health. So, some housekeeping rules. Simultaneous interpretation is available in Arabic using the button with a global icon, which is in the down the toolbar. And there is closed option for English captions. And you have to click the CC button again down in the toolbar. This course has got a option of speaking even in getting even in French. Next slide, please. So the course objectives are enhance the knowledge, confidence, and communication skills of both current and future health professionals concerning the climate change impacts on the health so that they can deliver improved public health and clinical care by recognizing and addressing the climate risk. Number 2 serves as trusted advocates influencing policy and practice within their institutions, communities, and professional networks. The second course objective is equip the current healthcare professional with the knowledge and skills to educate their institutions' own learners, ensuring that climate-related health impacts and emergency preparedness are systematically integrated into pre- and post-licensure training worldwide. Number 3, build and strengthen an agile and informed community around climate and health education, advocacy, and policy for health professionals with strong mentorship and expert support. So today on February 18th, we are having the session 2 that is about the degraded air quality, and we have got 3 wonderful speakers who will be speaking about the impacts of poor air quality on the human health. So the specific learning objectives for this session is this one, the learner should be able to describe the pathways through which climate change relates to and exacerbate air pollution in Eastern Mediterranean region, including increases in the ground level ozone, particulate matter 10, particulate matter 2.5, dust, toxic smoke, and other ambient respiratory irritants, as well as the interaction of temperature with wildfires and stubble burning. And the second learning objective is at the end of the webinar, the learner should be able to describe the effect of climate change in causing temperature inversion leading to toxic smog in winter months of a number of countries in the region. And they should be able to describe the mitigation strategies to address the challenges of smog and associated diseases. Learning objective number 3 is the learners should be able to describe how climate change contributes to increased dust events in the Eastern Mediterranean region, their impacts on air quality, respiratory, and cardiovascular health in vulnerable populations. Number 4 LO is the learners should be able to describe how these pollutants impact climate-sensitive respiratory diseases such as asthma, chronic obstructive pulmonary disease, chronic lung disease, cardiovascular disease, cerebrovascular disease, and the effect on the pregnancy and the reproductive outcomes, and the effect on the allergic diseases. Learning objective number 5, the learner should be able to identify populations that are vulnerable to degraded air quality. And the yellow 6 is the learners should be able to describe how health professionals can protect these vulnerable patients and teach about the risk management such as limiting outside work and recreation during poor quality days. And the last but not the least, LO, that learners should be able to describe the near-term health co-benefits such as improved air quality resulting from climate mitigation efforts at both national and transboundary scales. So regarding the session logistics, Our sessions are usually 90 minutes long sessions, which includes expert lectures and case study presentations. Sessions will culminate with a question and answer session, and you can enter your questions for the presenters in the Q&A box, which when you click on the three dots, you will be able to see Q&A box. And these sessions are video recorded, and slide decks, recorded sessions, slide decks, and resources will be made available on the course website. Regarding the policy of attendance, attendance is automatically recorded during the live Zoom sessions. So make sure that you log in with the same email with which you have registered. Your individual attendance is only counted if you join using your personal Zoom link. Your attendance is not counted if you join with a colleague's link. And YouTube viewers will not count towards attendance. And regarding the certificate of participations, participants who attend 7 or more of the live Zoom sessions and pass the final examination with a score of equal or more than 70% at the end of the course will be awarded a certificate of participation in climate change and health from the Global Consortium on Climate Change and Health Education. Note, the certificate of participation is only available to people who use the same email for registration, all Zoom sessions, as well as for the exams. Final exam, the exam must be completed using the same email address which you have used to attend the Zoom sessions. The exam link will be sent on the final day of the class via email and WhatsApp, and it will close on 4th of May 2026 at 11:59 p.m. Cairo time. The format will be equal to 25 multiple choice or true and false questions, and participants should be prepared to take the exam at one sitting. So whoever is interested in joining our WhatsApp group, you can scan this QRS code and join, which will give you more updates and information from the course planning team. The link is also shared in the chat. So for today's session, we have got an amazing panel of speakers who are experts and with lots of experience in the field of air pollution, reduced air quality, and the impacts of these on the human health. Our first speaker, she will give a lecture, and her name is Dr. Nargis Khanjani, who is a medical doctor as well as she is a environmental specialist. She is a professor in environmental epidemiology, Harvard Medical School, USA, Iran. And our second speaker, the speaker who will be presenting a case study is again a medical doctor who is again associated closely with the WHO. He is Dr. Najibullah Mujadidi, who is from Afghanistan, and he is with the National Emergency and Trauma Care as part of the WHO Afghanistan team. And last but not the least is Prof. Sata Fatmi. He is a professor and section head at Medical College, Aga Khan University, Pakistan. So let us all wait to listen to their lectures. The first lecture will be by Dr. Nargis Khanjani. She is a medical doctor. She holds an MD from Tehran Medical University and a PhD from the Medical Center for Occupational and Environmental Health. She is one of the first scientists who studied the adverse health effects of climate change in Iran, and she has co-authored more than 100 papers and abstracts about the health effects of climate change and air pollution in Iran. She is the fellow of American College of Epidemiology and a fellow of the International Society for Environmental Epidemiology. Currently, she is the professor of environmental epidemiology at Texas Tech University Health Sciences Center of El Paso, and she is an adjunct research fellow at the Monash Center for Occupational and Environmental Health. So over to you, dear Dr. Nargis. So let us listen to Doctor what she is going to speak about the effects of poor air quality on the human health. Over to you, Dr. Nargis.
Okay, thank you very much. Hello, and is my voice clear?
Yes, doctor.
Okay,
Yes.
okay, thank you. So hello and salamun alaikum to my colleagues in the Middle East and North Africa and anywhere in the world that you are. Ramadan Mubarak and full of blessings for everyone. Today I have a lot to talk about and only 35 minutes time, so I will start right away. Okay, the Eastern Mediterranean region is facing significant environmental health challenges, and one of those challenges is air pollution. The main drivers of air pollution in the EM region are the hydrocarbon fueled economy and the industries that are emitting tons of greenhouse gases. Some of the countries with the highest emissions per capita across the globe are in this region. The EM region also has a large population, which is increasing, and it is a major center for domestic and international traffic by sea, air, and land. Now, more than 80% of the global dust originates from this region, and these regions have consistently experienced dust storms throughout history due to their arid climate, because of the dry lake beds and sparse vegetation. And now human activities and climate change are further intensifying the frequency and severity of these dust storms. Air pollutants have different categories. One of them is the key air pollutants. Key air pollutants are the ones that are regulated by the EPA in different countries because they have significant health impacts. They are monitored. But there are another group of gases or atmospheric pollutants that are classified as greenhouse gases. And these two groups do not exactly overlap. Greenhouse gases are the ones that are contributing to the greenhouse effect and the warming of the earth. Now, air pollution, specifically the greenhouse gases, are causing climate change, but climate change itself is causing air pollution and is causing dust storms. So actually, we are caught in a vicious cycle. In this session, I'll be more focused on the air pollution that is the result of climate change. Now, how does climate change contribute to air pollution? Climate change contributes by creating more and more deserts because the bushlands and the agricultural land has been impacted by drought. Also, wetlands shrink and sediments are left bare, and they become efficient dust sources. This dry land, in conjunction with strong winds, leads to sand and dust storms that contribute directly to air pollution by increasing particulate matter concentrations. Now, the EM region has observed a surge in the frequency and the duration and the intensity of sand and dust storms in the recent years. And according to climate models, sand and dust storms will become even more severe and more frequent in the coming years. For example, the United Nations reports that in some countries of this region, for example, Iraq, they could witness 300 dust events per year within the next 10 years. To understand the severity of the situation, we need to know that some of the major cities in the EM region are listed among the world's worst in regard to PM10 concentrations. For example, Riyadh is ranked the 7th, Bahrain is the 11th. In Kuwait, levels of PM10 can rise up to 6-fold higher than the WHO limits. In the UAE, levels up to 10 times higher than the WHO limits have been recorded. In Jordan, 85% of the population, and in Lebanon, everybody has experienced sand and dust storms. Now, since the year 2000, the MENA region, which you know is the abbreviation of Middle East and North Africa, has experienced continuous drought because of climate change. And the frequency and the intensity of these drought events have increased in comparison to the 20th century. Researchers predict that because of the expansion and activation of new dust sources in the EM region, including in countries like Oman and Yemen, dust storms and the PM concentrations will increase even more in this region. And this phenomenon is happening because of the results of climate change, which are temperature increases, decline in soil moisture levels, loss of vegetation, and elevated wind speed. Some of the dust sources in this region that have been affected by climate change have been listed here. So in Iraq, the river valleys of the lower Tigris and Euphrates have dried a lot. Wetlands have dried, marshes have dried. Lake Saba in the south of Iraq has dried. And this has created exposed salt sediment surfaces. In Iran, in the southwest, the Shadigan and Hurul Azim wetlands have dried. In the southeast, the Jazmurian has turned into a dry, intermittent lake bed. Lake Urumia in the northwest of Iran has mainly dried and is now turned into a large-scale exposed saline lake bed that is adversely affecting regional air quality. And in Isfahan, the river Zayanda Rud has dried and created a new dust source. Other dust sources are the one that we have on the Iran-Afghanistan border. The Sistan Basin, which was formerly the Hamun Lake, has now turned into an exposed lake bed, and the sediments, along with the 120-day Sistan winds, are causing ambient particulate matter concentrations to reach up to 60 times the permissible levels in cities such as Zabul in Iran. Haboobs are a specific form of dust storms. They're basically a thick cloud of particulate matter, and they are very dangerous. They pose serious threats to human health. Haboobs are becoming more frequent and more severe because of climate change as well. Wildfires are another consequence of climate change. Wildfires occur because of the periods of drought and high temperatures. And when they happen, episodic spikes in air pollutant levels occur. Wildfire contains a lot of dangerous chemicals, especially if wildfire approaches residential areas where furniture and electronics and plastics are burned. Toxic fumes can enter the air. Now, in the summer of 2025, which was not far ago, several wildfires occurred in the EM region, and you can see some of them listed here. But one of the most devastating was the one that happened in northern Iran in the Hirkani forest. And this happened in October and November 2025. Now, this forest is a UNESCO World Heritage Site, and it is extremely beautiful, but has been damaged because of the wildfires. And the wildfire that happened was actually difficult to control because of the dry vegetation and unusually warm conditions. It took 2 to 3 weeks to control, and Iran had to ask neighbor countries for help. During this time, the air quality degraded seriously across parts of northern Iran. Now, because of climate change, the marshes are losing water and the vegetation is turning into a dry, flammable tinder. And this makes the region highly susceptible to wildfires. An example of this is what happened in May 2022, where thousands of hectares of the Hurul Azim wetlands on the border of Iran and Iraq caught fire, and the smoke and air pollution was so severe that schools and offices in that region had to shut down for several days. Now, climate change is also leading to changes in the atmospheric chemistry, and the best example is ozone. Now, we know that tropospheric ozone is an important secondary pollutant. It's the product of several other air pollutants that react in the atmosphere in response to the rising temperature and solar radiations. The other factors that are important in the formation of ozone are low humidity and reduced precipitation. Now, there are several studies from the EM region that are showing that as the temperatures are increasing because of climate change, the levels of ozone are increasing as well, and they are predicted to even raise more than this in the future. Temperature inversion is a weather setup. It traps air pollutants near the ground, and it has happened from a long time ago. Basically, in the normal situation, warm air, which is close to the ground, can rise and take the air pollutants with it to higher levels and away from people's respiratory zone. But when inversion happens, there is a warm layer of air that covers the cool air and does not allow the pollutants to escape. Climate change has created conditions that produce longer and stubborn winter inversions, and the toxic smog that comes with inversion to be more common and more intense. Now, an example of inversion is what happened in the fall of 2025 in Tehran. Pollutants were trapped under a dome of stagnant air, and the levels of air pollutants reached very unhealthy levels during this time. Okay, now let's talk about the health effects of air pollution. First of all, mortality. Ambient air pollution alone has caused more than 370,000 premature deaths a year in the EM region, and this number is strongly believed to be an underestimate. The reasons of death are due to 5 main outcomes that have been listed here. Mainly, it's cardiovascular death or respiratory death. The Iranian Ministry of Health has estimated that only in 2024, 59,000 Iranians died prematurely because of air pollution, and 15% of deaths that happened among children under 5 years old were related to air pollution. The economic loss was huge and was even more than the country's entire health budget. Other researchers have estimated that in the year 2012, in only 9 nations of the EM region, something more than 150,000 people died just because of exposure to fine particulate matter. Now, the diseases that are related to air pollution have a big list. On top, you can see the cardiovascular diseases and the respiratory diseases, but researchers believe that air pollution can lead to other diseases as well. One of them is cancer, diabetes, neurological disorders, GI disorders, kidney and liver diseases, skin diseases, and adverse pregnancy outcomes. Now, the effects of sand and dust storms are even more complicated because dust storms include particulate matter, and this particulate matter can contain different types of minerals, different chemicals. Particulate matter can also contain biological agents like viruses and bacteria, and we will talk about how it can increase infectious diseases as well. Now, if particulate matter is fine particles like PM2.5 or smaller, it has the ability to enter deeply into the lungs, and it can cause inflammation, oxidative stress, and alterations in immune response. Some researchers believe that PM is also capable of causing cancer, causing Alzheimer's disease, dementia, diabetes, and especially the PM that is generated from wildfires can be very toxic. So basically the more important health effects of sand and dust storms are the cardiovascular and respiratory diseases. But the effects of sandstorms are different in short term and long term, and then their effects on different subpopulations, like different age groups, different genders, population structures, social behavioral subpopulations is different. And this is an area that needs more research, especially for you as researchers in the EM region. These are areas of research that we still need to work on. Also, there are diseases such as the nervous system diseases, genitourinary system, and mental health disorders that we are just starting to learn more about the effects of sand and dust storms on these diseases. And this is an active area of research that you as researchers can consider. Okay, allergies. Now, climate change is increasing allergies. And Probably the most important reason that is happening is because of the alterations in pollen production in plants. So pollen quantity is increasing, the allergenicity of pollen is increasing, and there is a longer season now in which pollen is released. Pollen concentrations are estimated to increase even further in the future as greenhouse gases increase. An example of this would be what happened in Khuzestan, Iran in 2013. After a thunderstorm, in less than 10 hours, more than 2,000 patients rushed to the emergency wards. 1 year later, in 2014, after the similar event, more than 10,000 patients rushed to emergency wards. And in 2015, this number was more than 26,000 people. Now, the photo on the right is from this event, and you can see how there's not enough infrastructure to support the huge crowd of patients that have come to the hospitals. Now, there are studies that show fine particulate matter like PM2.5 can directly enter brain tissues through the olfactory nerve, and eventually it can cause cerebral blood vessels, damage to the blood vessels and the brain nerves, or it can travel across the lungs and the gut, and it can enter the bloodstream and cause systemic oxidative stress and inflammation. Now, more research has to be done about this field. In the EM region, we don't have that much research about this topic, but there are few studies connecting dust and air pollutants to multiple sclerosis and to epilepsy. Now, climate change can increase the incidence and the pattern of infectious diseases, and it can do this through multiple routes. One route is through increasing heat, but I'm not going to talk about that. That is the topic of the next session. In this session, I'm only going to talk about how it can do this through the dust storms and increased ambient particulate matter. So as we mentioned, PM can contain bacteria, fungi, and pathogens. In the EM region, we have studies that have looked at the connection between dusty conditions and outbreaks of infectious disease like Shigella, Salmonellosis, SARS, COVID-19. In North Africa, meningococcal meningitis, and in Iran, tuberculosis has been studied. Now, dust storms can lead to a wide range of symptoms. Some of them have been listed here: coughs, runny nose, eye irritation, headaches, and I'm sure this is familiar for those of you who live in these dusty cities. In the EM region, other effects such as the relation of dust to DVTs or deep vein thrombosis, and also to kidney function, to altered kidney function, has been evaluated as well. Low visibility is another consequence of dust storms that increase vehicle accidents. And there have been reports of increased cases of trauma being transferred to emergency wards because of the increase in motor vehicle accidents. Now, lay people are feeling and reporting the negative effects of climate change and drought. And this is a call to the politicians who are still ignoring the effects of climate change. This is a result of a study that was done in southeastern Iran, an area that has been affected seriously by climate change. And this is a qualitative study. They interviewed people. Farmers who participated expressed concern about unemployment and poverty, and the fact that they have to migrate and turn to fake jobs such as fuel and drug trafficking in the cities. They've also expressed concern about their mental health, their despair, their mental tensions, insomnia, depression, and anxiety. These people listed a long list of physical health effects. Some of them are difficult to relate to air pollution, but that is how they feel. They are relating all of their physical and mental disorders to the changes that are happening in the environment around them. They're also complaining about decreased community well-being, decreased liveliness, decreased motivation, happiness, decrease in their social and fun activities because green spaces are becoming less and sandstorms don't let them enjoy the environment. They're also complaining about social dissatisfaction due to poor performance of government officials and mismanagement of water resources. Okay, so we can talk about pollutants for hours and hours, but we don't have time. So I refer you to this booklet from the WHO that has summarized the effects of ambient air pollutants, and it has also made suggestions for the thresholds, the safety thresholds. Now, in air pollution, we have vulnerable populations. These populations need more attention because they are more sensitive to the effects of air pollution, and they include children under 18, adults over 65, people with underlying health conditions like asthma or cardiovascular disease, pregnant women and their fetus, people in poverty and ethnic minorities, probably because they live in areas with more air pollution, people who have to work outdoors, and people who are immunocompromised. Now, among these groups, pregnant women need particular attention, and it is critical for obstetricians and midwives who work in the EM region to know about the risk that air pollution has for pregnant women. Air pollution can increase the likelihood of blood pressure, preeclampsia, low birth weight, and preterm delivery among pregnant women. Wildfire smoke is even worse, and it can have even more serious effects. In addition to that, post-traumatic stress disorder is more common among pregnant women, and then decreased rates of breastfeeding have been reported to happen after wildfires. Now, in Iran, the studies have related PM10 with spontaneous abortion and premature delivery. They have also related ozone with preeclampsia. Now, risk mitigation is what we all want to happen. And the WHO has guidelines about this. Several booklets are available for nations. They can set their own specific goals and then walk towards that goals with help from the resources at the WHO. Now, here I have divided the risk mitigation efforts into two groups, the short-term solutions and the long-term solutions. Risk mitigation is absolutely necessary for the EM region, and the reason is that according to the IPCC report, the latest report, this area, this part of the world is at critical climate-driven risk, and this risk includes extreme heat, exceeding human survival limits. I'm pretty sure that some of you have already experienced this in your hometowns. Severe water scarcity, worsening dust storms, and high risk to food security. Even under the moderate emission scenarios, this region faces intense drought and increased risks of mortality. Okay, so the short-term solutions are, one of them is the warning system. I'm sure that you are aware of these systems. There are websites and there are apps that you can have on your phones, and we can encourage people to have these apps on their phones and regularly check the levels of pollutants in their hometowns. According to the level of pollutants, people can plan about what to do for their day. Now, this is an example of the charts that are available, and people can use them for different levels of air pollution. This is from an American website, but I'm sure that you have similar things in your home countries, or you can improve them based on the evidence from different studies. According to this chart, people can have a look about how much physical activity they can have and what are the sensitive groups that are not advised to go out when the AQI levels are high. Now, this is an initiative that is happening in some U.S. schools. So the children at school, there is a person responsible for this flag, and according to the level of air pollutants, they rise this flag. And then according to that, they know that can they go out for physical activity or they have to stay indoors. And then the students that are sensitive also know that is it a good day for them to play outside or not. These are initiatives that you can tailor to your home countries and use them in the EM region. Now, for decreasing exposure, there are a lot of initiatives. One of them is using electronic medical records. So people who are among the vulnerable populations, they can get connected to automated alerts, and they can receive an alert on their phone saying that today the pollutant levels are high and it's not a good idea for you with this condition to go out. Also, people should be advised to avoid exercising outdoors when the pollutant levels are high. Even in situations where the forecast is green, people should be advised to avoid exercising near high traffic areas because the vehicles are producing a lot of toxic chemicals. Also on summer days, because ozone levels are high, especially in midday, if people want to have outdoor activities, they should better have that activity in the morning. People who need to go out should get advice on high quality masks to protect themselves. They should also learn to have sealed windows and doors so that if the outdoor pollution is high, they can protect their indoor air. Using air purifiers is becoming common, and they can reduce the concentration of pollutants in the inside air. Now, wildfires are a unique topic, and the US CDC has published guidelines about how people can stay safe before and during and after a wildfire. So I refer you to those instructions. They are pretty brief, like in 2 pages, and they include the essentials. What I want to emphasize here is that give written information to people, because during a wildfire, the last thing that works is people's memory. Okay, so some advice for wildfire events is here. Vulnerable populations need specific attention, including pregnant women. Pregnant women exposed to wildfire smoke are at risk of preterm labor, and they should be counseled on the signs of preterm labor. They should have a plan so that if this is happening, they know what they have to do. Also, patients with underlying conditions, the elderly, and parents with young children who live in wildfire risk areas should be advised on evacuation readiness. They should have a go bag that includes the essentials and their medications. Now, for decreasing emissions is what we have to do in the long run. You are aware about the Paris Agreement and the Kyoto Protocol, which are frameworks for international cooperation on climate change mitigation. Now, in the EM region, some countries have not signed the Paris Agreement. Some of them have signed, but have basically done nothing, which makes no difference from not signing. Governments should provide clean transportation for their populations, vehicles with low emissions, and fuel quality standards should be followed. Governments should also invest in promoting active transportation for the populations. Now, one of the things that I want to emphasize is clean energy. The EM region is abundant in sunshine and wind, and these are 2 sources of energy that we should take the most advantage from. Now, some countries of the region have already started their clean energy farms, and you can see some of them have been mentioned here. These are good examples for other countries to follow and use the resources that we have for producing clean energy in the EM region. Now, I gave you a good example. This is a bad example. In Iran, toxic mazout is being used for producing electricity, is being burned and for producing electricity to cover the electricity shortage. And this is causing toxic levels of air pollutants. Now, as environmental scientists, we have a responsibility to speak out against actions like this. And I know what you're thinking. You're thinking, okay, the politicians don't listen to us. They do whatever they want to do. Yes, I agree with that. But this does not decrease the responsibility that we have in regard to protecting human health and advocating for sustainable energy. Okay, the other things that should be done in the long run, water resources in the EM region are scarce. They should be managed properly. Inefficient irrigation practices should be phased out, and we should move toward efficient, modern irrigation systems. Vegetation should be restored, and then we should revive the wetlands and the lakes in this region. Monitoring systems are already available in many countries, and they're already monitoring the situation of air pollutants, but they can be even better. We can have more monitoring in more locations, and we need to establish early warning systems from these monitoring systems to prepare people for the incoming dust storms or the high air pollutants. And then we can reduce the health risks and the economic losses from these air pollutants. Behavioral change and educating the public is extremely important. And in many developing countries, they have already started campaigns for teaching their citizens. Educating people about using energy less and using energy from clean sources can be very helpful. Also, people should learn not to burn wood or trash. In the rural areas of many developing countries, they burn trash because there is no waste collection services, and that contributes seriously to the air pollution, to local air pollution. Now, these are examples that I found from the American Lung Association website and the CDC. You can have a look. These are short videos for ordinary people. And the thing that is unique about these videos is that they are simple and easy to understand. So you can have a look here and get ideas for your home countries about how to create easy to understand videos in local language, and then direct people to watch these videos and learn about how they can protect their environment and protect themselves. Okay, law enforcement, a big issue in the EM region. In countries in this region, we either do not have air quality guidelines and regulations, or we do have something, but it is not implemented. And this is one of the things that has to make improvements in this region if we want to decrease the level of air pollutants. Bilateral cooperation among countries in the EM region is important because air pollution does not respect international boundaries. You can't work on the air pollution, decreasing air pollution in your home country and not care about the dust that is coming from the neighbor countries. Strengthening regional cooperation and collaboration on air quality management can facilitate knowledge exchange, capacity building, and joint action to address the transboundary air pollution issues. And finally, research and collaboration among countries are important for the issues that we don't have enough information about the short-term and long-term health impacts of air pollutants, as well as the synergistic effects that air pollutants and heat have because of the climate change effects. Enhancing in the research budget allocation to air pollution, creating centers of excellence, strengthening research collaboration among countries of the EM region, and also other countries worldwide which have more experience is important. And then satellite data, air quality monitoring networks, remote sensing technologies, atmospheric modeling techniques can all help in mapping pollution sources and understanding the pollutant transport pathways in the EM region. And this can help assess the impact of air pollution on public health and environmental quality and can help us improve the situation. And as my last statement, I'd like to say that environmental health and science is more than measurements. It is a moral obligation. Knowledge creates responsibility, and evidence creates the rationale for action. Our task is not simply to understand what is happening, but to choose to use understanding in the service of care, justice, and the dignity of future lives. Okay, the references that I have used have been listed here, and in case you need more information about the topics that have been mentioned in the slides, you can visit these references. Thank you.
Thank you very much for that very informative lecture, Dr. Nargis. Thanks a lot. It was very informative, and like you said, more than understanding, we need behavioral changes as well as climate action. Thank you. I think, shall we take the questions in the end?
Yeah, let's skip to the end.
Yeah. So I think let us move on to the next speaker. That is Dr. Najibullah Mujadidi. Dr. Najibullah Mujadidi.
Yes.
Thank
Pleasure to meet you.
Yeah.
Thank you so much. Am I clear and loud?
Yeah, I will just introduce our next speaker. He is the National Emergency and Trauma Officer at the WHO County Office in Afghanistan with over 10 years of experience in trauma care, emergency medicine, health system strengthening, and climate resilience. A medical doctor specialized in traumatology and general surgery with additional training in urology and emergency ultrasonography. And he has also completed climate change and health faculty development training through the Columbia University. At the WHO office in Afghanistan, he leads initiatives on climate resilient health development of climate resilient health systems, vulnerability assessments, action plans, and emergency care, capacity building. And he is a WHO certified master trainer in key emergency responses programs. He has actively supported major emergency operations, including earthquake and floods response across Afghanistan. And we are very lucky to have you, sir. And it's a very rare combination that an emergency and a trauma care surgeon who is really interested in climate change and health. Now the floor is yours, sir. Thank you.
Thank you so much, dear colleagues. Ahlan wa sahlan. Assalamu alaikum wa rahmatullahi wa barakatuh. Ramazani Kareem to every one of our colleagues, friends, and the participants in this training. Before I start, I would like to extend my sincere appreciation to Dr. Danieli, the Senior Project Director, and the team for the Global Consortium on Climate and Health Education, to Columbia University for their smart work, their dedication, and the energy they have for providing this valuable opportunity to health responder and deepen their understanding of climate changes and its impact on public health. Last year, I had the privilege of participating in the climate change training, which was an enriching and insightful experience. I'm especially honored that this year I had the opportunity to present a case study as a part of Eastern Mediterranean Climate and Health Responder course. I would like to also thank our colleagues, our friends, and the participant in their engagement in this course. So before I start, here is the introduction and the background. I will ask our colleagues, our friends, and the participants to focus on this image, which is available in the first slide, and see which objectives or which objects they can see in this photo. So they have 15 seconds to see what is in the photo, and they can write in the chat box. Only 15 seconds. Sunset, road, sun, fog, man, bicycle, sunset, haze, fog, sun, persons. Yeah, thank you so much. Actually, this is a photo in which we can't see sunset. It is the sun up. It's early morning. It's 8 o'clock and 53 minutes in the morning. So because of the fog and because of the air pollution, we cannot even judge the time during the day, during the afternoon, and during the evening. So this is what we would like to let you know, at least to understand under climate change's introduction in the background. So based on data from 2024 and early 2025, Afghanistan is consistently ranked among the top 10 most polluted countries in the world, with its capital Kabul and often appearing in the top 10 most polluted cities. So I will be also sharing the link for the world air quality data. So we can say that Afghanistan is among the world's most climate vulnerable country, facing severe droughts, extreme weather, and rapid rising temperature that strain community ecosystem. You know, during winter, air quality deteriorate sharply because in almost each household they burn coal, wood, and even plastic for heating, which creating thick toxic smoke in major cities like at central region Kabul and as well as central highland region, northeast region, southeast region, and many other provinces of this country. You know, urban pollution is intensified by outdated vehicles, diesel generators, and poor waste and sewage system across the country, which overwhelming already fragile city infrastructure. Climate changes worsen dust storms and prolonged droughts, reducing rainfall and drying landscapes, which further degraded air quality across Afghanistan. The above mentioned environmental pressure have damaged agriculture, reduced water availability, and pushed vulnerable families into displacement and food insecurity as well, which might not develop, or I can say, not strong environmental governance and limited public services. So, so I can say that Afghanistan communities remain highly exposed to respiratory disease and environmental hazards. Next, please. So I have just focused on few objectives for my case study in which identifying the main source of air pollution in our country, including winter fuel burning, coal, wood, and plastic, outdated vehicles, which I have mentioned earlier in my first slide, and also determining the health impacts on Afghan communities, specifically focusing on rising respiratory diseases, reduced air quality during winter, and increased vulnerabilities among urban poor and children. Explaining explaining not most strong infrastructure and governance contribute to environmental degradation, including poor waste system, open sewage channels, and lack of pollution control mechanism across countries like filter unavailability, I can say. Mitigation and adaptation strategies proposed tailored to Afghanistan context, such as cleaner household energy option, strengthen urban planning and community-level climate resilience program. Here is we can see the methodology. So I had, let me tell you that I have just used three methods to clearly understand on these on these case study. The first one is the literature review, climate change impact analysis, and the most integrating part. When I spoken to Dr. Danieli to present the case study, I have interviewed a field person on my community level. So literature review, this is existing report and assessment in Afghanistan climate risk, air pollution, drought trends, environmental degradation were reviewed to understand national level climate impacts. This includes documented evidence of worsening, particularly extreme weather affecting Afghan communities. Let me tell you that we have the World Health Organization approved climate change vulnerability assessment. And I have done the assessment in 11 hospitals on climate data and vulnerability to evaluate how increasing temperature, reduce rainfall, and intensified dust storms worsen air quality across this country, Afghanistan. These climate patterns have been taken from national and region-specific climate profile. Next, please. Here are few health consequences. In this slides, I had a photo of the local incinerator, so I was proposed to share my own presentation, but I have a electricity of great problem. That's why. So in this health consequences, I have just mentioned few of them, like degraded air quality cases, widespread respiratory illness, and including asthma, chronic bronchitis, and breathing difficulties, especially in winter. Toxic emission from fuel burning, old vehicles, and generators increase the risk of COPD, lung cancer, and cardiovascular, such as the heart attacks and strokes. Children and the most elderly people with existing illness with the comorbidities are highly vulnerable to polluted air and severe winter smoke. Climate-driven droughts and dust storms further weakens immunity and contribute to disease outbreaks in poor health and affected communities. The combined pollution burdens leads to preventable illness and premature deaths, creating major financial and healthcare strains on Afghan families. Next, please. Here are a few preventive measures. Promote cleaner household energy by reducing the use of coal, wood, and plastic for heating. Improve urban waste management to prevent open burning and reduce toxic fumes. Strengthen vehicles emission control by phasing out dead cars. And implement climate resilience strategies such as better land and water management to reduce dust storms. Increase public awareness and community preparedness on air pollution risk, proper ventilation, mask use, and safe heating practice. Here are challenges and few recommendations. In challenges, severe winter air pollution from household fuel. This is one of the challenges, as most of one household rely on burning coal, wood, and even plastic for heating during winter. During this particular situation, even in this first day of the Ramadan, climate changes is driving increased temperature, prolonged droughts, and more frequent dust storms, all of which worsen air quality and public health risk. Poor waste management, open sewage channels, outdated vehicles, and lack of pollution control system significantly worsen environmental condition or air quality. I have also few recommendations which I will be able also to discuss with the stakeholders. They expand access to cleaner heating and energy, strengthen climate adaptation measures, and as well how we can improve urban environmental management. I thank you so much. If our colleagues and friends are having any question, please write down the question in the chat box and we will answer to your questions. Thank you. Back to you, Dr. Danelli and team.
Thank you very much for that very informative talk, Dr. Mujadidi. And now we will move on to Dr. Safar. He is from Pakistan and he will be talking about the impacts of poor air quality in the context of Pakistan. Dr. Safar is a public health physician and he is an environmental health researcher, and he has got over 150 peer-reviewed publications, and he is ranked among the top 2% of most cited scientists globally as per the Stanford University ranking. He holds an MBBS and FCPS in community medicine, and he has got 2 PhDs on environment as well as health from the University of Southampton, UK, and GC Medical University, Japan. He serves as professor and section head of environmental and occupational health and climate change in the Department of Community Health Sciences at Aga Khan University, Karachi, Pakistan. His research focuses on air pollution, climate and health data systems, and environmental exposures. He actively collaborates with World Health Organization both at national and regional levels. So we are really privileged to have you, Prof. And over to you. Thank you.
Thank you, Shiba. This is Zafar Fatmi. Assalamu alaikum, everyone, and good evening from Pakistan. Thank you, Columbia University, for inviting me for this talk, and thank you all for joining. So what I'm going to talk about is a case study or more about Pakistan, how the air quality in Pakistan has degraded over time and what needs to be done. Some of the health impacts also I will talk about, and what needed to be done in terms of individual level, what you can do at your level, and also what is more important at the policy level, what is needed to be done at that level. So let me begin. So the purpose of this case study is, Pakistan is one of the worst affected by air pollution, and particulate matter 2.5 is the particle size of the air pollution, which is has the most health impact. So I'll talk about that. So it is affected by exposure to that. And PM2.5 is the most dangerous or the most health impact related particles in the air, which affects the global population. So that I'll talk about, and then why it happens, why air pollution, and my previous colleagues have talked about at length about urbanization and weak regulatory enforcement, or all of that, which leads to worse air quality. This air quality has environmental justice or justice issue also, because it affects the vulnerable populations. So 99% of the global population which are affected are in the low-income countries where most of the health burden occurs because of the air pollution. So, and also within those, young children and elderly, and also the lowest income group or low-income group are most exposed, because those who travel in cars, those who travel in better vehicles are less exposed than those of the pedestrians and working on the streets, etc., or working outdoor in the outdoor air. So climate, so there's also, I'll talk about a little bit, which Nargis has talked about at length, that how climate impacts air pollution, and air pollution impacts climate change. Changing climate leads to high air pollution, and there are co-benefits of, intervening or reducing air pollution will also lead to reduction in, the reduction in carbon dioxide, and leads to improvement in climate change, and vice versa. So that those are the things we'll talk about. So air quality is not just an environmental issue; it's a structural, systematic, and preventable issue that we'll talk about. So starting quickly, the global mortality which occurs approximately annually is about 60 to 65 million people. So annually, globally, about 65 million people dying, and of those, we estimate that 34 million people deaths are preventable. And of those, about 12.5 million deaths are alone due to environmental factors. And among the environmental factors, air pollution is the largest environmental risk for the human health globally. It causes 7 million deaths annually from both outdoor and indoor air pollution. So that is the importance of air pollution you need to understand. So we talked about, about 20, there's 7 million deaths due to outdoor air pollution and indoor air pollution throughout. But if you look at the air quality in Asia, this is a little old data, 5-year-old data about PM2.5. Bangladesh, Pakistan, India, Mongolia, Afghanistan, the less developed countries have high PM2.5 levels, like 77, 59 in Pakistan, and 52 in India, and so on. But the air quality in other developed countries in Asia, like Japan and Singapore and Philippines, you can compare, is about 10 to 15. In Pakistan, the average PM2.5 is 60 microgram, as I said already. But the annual target, which is the final target set by the World Health Organization, is 5 microgram per meter cube. So you can understand it's like 12 times the levels in Pakistan. And several of those other countries, the levels are very, very high. There's 24-hour final target also, means in a particular, in a single day, the levels could be higher due to any particular reason because of the climatic conditions, the weather conditions, and that is also just 15 microgram per meter cube. So there are, for developing countries like Pakistan, there has been other targets have been set, like interim targets, which could be from, the first interim target is 35, and the second interim is 25, and so on. So we are far behind from those targets. So the whole population is affected by the air pollution seriously. So if we look at the disease burden risk factors in Pakistan, and we measure it by disability adjusted life years, so about 11.2 million deaths or DALYs, disability adjusted life years, including deaths and diseases, are due to air pollution, including both outdoor and indoor air pollution. And this is the largest risk in Pakistan compared to some of the other risk factors for human health, like high blood pressure, child wasting, or you talk about high blood sugar, smoking, etc. So you understand how big is the risk factor in Pakistan. The reasons we know already. So in the ambient air, the industrial pollution and the vehicles are causing ambient air pollution. But most of the Eastern Mediterranean also, there's desert dust, which contributes heavily. But in Pakistan, obviously, it's less contributed by that. But also there's the large risk factor within, inside the household, which is the use of wood and biomass for cooking for the woman. And I'll talk about that. So so in Pakistan, if we look at the overall picture, so the cities which are in Punjab province and in Sindh province, the two largest provinces, which are heavily affected. And some, the estimates by WHO is that those children which are born now in Pakistan, their life expectancy is about 3.9 years less due to air pollution. So you can understand how big is this risk factor. And some of the cities like Lahore, Singapore, Kasur, Peshawar loses about 7 years of life. This is Lahore city, one of the biggest mega city. And you see on the left in July, and you see on the right in November 2020. It's the same time the pictures have been taken more or less, but you see the temperature inversion has led to what kind of conditions in Lahore. So this is like a smog situation in Lahore. And we tracked the data from 1998 to 2020, about 22 years, and you see a steep increase in air quality, PM2.5 data from 1998 in Lahore. And that has, because of the, you call it development or increase in vehicles, increase in industries, and the climate change. Why this occurs, just simplified, again, my previous colleagues have talked about this. So the particles goes into the lungs, the air pollution particle, it affects the lungs, but it also, transfer through the lungs, through blood, into the body, the entire body. So it goes into the cardiovascular system, and then it affects brain, kidney, placenta, fetus, and it can cause cancer. That's why, and the methods, written that there's a systemic inflammation and blood-borne mediators lead to these diseases. So that's how it affects the whole body. That's what many people don't understand, why it affects the whole body, how it affects the cardiovascular, how it causes stroke. This is one study in Karachi city, which is the largest city of Pakistan. And we looked at the admissions in the hospitals. So the admissions in hospital increases about 20 to 70% in relation to the increase in air pollution. As the air pollution increases from 50 to 200, so the increase in daily admission for cardiorespiratory diseases in the hospitals increases. It correlates strongly with that. We have conducted several studies, but this is one more study I want to highlight here. So this is the kitchen situation in most of the rural areas in Pakistan. Biomass or wood burning or the cow dung use is about 50% of households in Pakistan use that. And we did conduct a study among the women who uses biomass and those who do not use the biomass, those who use the natural gas, for example, and we look at the risk factors of heart attacks in those women. So what we found, interestingly, so these were the measurements. So if you look at the top line, which is in the biomass kitchen measurements, the breakfast, you get the exposure levels of about more than 1,000 micrograms. You understand the levels we need is 5 micrograms and below. And at the lunchtime, when the stove is started again, you get 1,200 micrograms. And at the dinner time, it even goes up to 2,000. And comparatively, the blue line below is the kitchen of the natural gas users. You can understand the difference between the exposure which are occurring, in those to those women. And we did this study among, as I said, those who use biomass and those who use natural gas. The risk for coronary heart disease or the heart attack was 3.5 to 6.5 times higher among the biomass users compared to the natural gas users, women in Pakistan. So this is one of the large case control study we conducted in Pakistan for over 2.5 years. Moving on, so these are, there are many health effects studies available globally, as well as some we have conducted in Pakistan, but I'm not going to talk about due to shortage of time. I will come now to how do you prevent pollution exposures and pollution-related cardiovascular diseases and respiratory other diseases at an individual level and what you can do at the policy level. So at the individual level, the New England Journal of Medicine, which is a well-reputed journal, has released a guideline for patient-centered strategy. So those who are susceptible patients means they already have some disease. So if they have those, the short-term ambient exposure potential is high, so they should use the N95 mask. Staying indoor when there is high air pollution, they can use air filtration inside the house. And avoid alternate route, avoid exposures whenever possible. So high exposure daily, if the daily PM2.5 exposure is greater than 35, you can do this both. Air conditioning, exercise, and medications, all of that is possible. So this is at the individual level, which has been recommended now by this New England Journal of Medicine. But at the larger level, which are the main causes of emission, for example, for ambient air pollution in industries. So strict industrial regulation, especially like use of scrubbers, etc., filters and dust collectors are simple measures which can reduce the emissions from the industries to a great extent. Similarly, use of, if you have constructions going on, road construction or any other construction, so there's a social responsibility of vendors who are constructing that, just sprinkling the water close to that whenever there's a construction reduces the dust exposure to a great extent. Transport policy. Transport has many co-benefits if you have good transport policy. So it has climate benefit, it reduces carbon dioxide, but it also reduces air quality, improves air quality if you have good transport. So your travel time reduces, your injuries reduces, your exposure on the road reduces, and it reduces carbon dioxide, which leads to improvement in, overall global climate change and temperature. But there are certain measurement challenges I'll talk about in a couple of minutes and I'll come to close. So measurement challenges are there. So limited regulatory monitors are there in developing countries like Pakistan. So there needs to be some investment into regulatory monitors. The monitors have become cheap. They are more regularly available. And WHO has recommended small monitors as well, which are just $100 and $200. So which are becoming more easier to monitor. But monitoring is the first step. So data gaps and non-public reporting, is a huge issue. So if the regulators don't do that, then everybody else start reporting, which becomes a problem as well. So use of satellite drive PM2.5, hybrid exposure models, and spatial interpolation means you have ground monitors and you have satellite data now easily available since last decade. So that can be used, which has been, modeled and developed, and there are many websites which provide that information. So I think we should utilize, and you all should utilize, even for the poorest countries, they have satellite data available, which can be utilized, and they're quite reliable, even if you don't have a ground monitor. But you should have a ground monitor or a hybrid exposure model where you have ground monitor and satellite data. The importance of high resolution exposure mapping is essential for determining health impact, because health impacts vary from one region to the other. You need to understand that. For example, the dust contribution in the Eastern Mediterranean for the air pollution is much more. And that impacts the health differently compared to something which is due to, some other elements like in Pakistan. So the contribution of PM2.5, same level of PM2.5 may have different health impact, because the combination of PM2.5 at different places vary according to the context. And that's why we need to conduct these studies in the context. So without measurement, credibility, policy credibility suffers. Means you make policy, but people questions. You don't have measurements. You don't have, it's not a reliable measurements and all of that. Probably the last slide, governance institution barriers are there, fragmented mandates. So transport, environment sector, industrial sector, they are all regulated by different, administration in most of the countries. So they need to come together to have a unified policy. And that's where one of the challenges, governance challenges for air pollution is there. So weak enforcement implementation is another for low-income countries, and political economy of brick, kiln, and fuel. So that's also one of the challenge. Climate policy is not aligned with air quality strategy, because both have co-benefits. If you work for climate or you work for air quality, both benefit each other. So we need to work on that. And their technical solution exists, but governance gaps persist. And governance gaps is the main. So integrating climate and air quality, clean air transport policy, renewable energy transitions, and health co-benefit framing can improve the air quality. And I'll end here. The air pollution control is not, with this message, is not a technological problem. We understand that, we can measure that and all of that. And also we know the solution. It is the governance, and accountability challenge in most of the low-income countries. Thank you so much for listening.
Thank you so much, Professor Safar, for that very informative talk about the impacts of climate change on the human health in the context of Pakistan. So like you said, there are a lot of gaps. And again, there are a lot of issues where the poor countries, they cannot afford to have a monitoring system also. So we may not be even able to measure the air quality levels in those countries. So now I think we will move on to Q&A. So there is one question which any one of the speakers can take and answer that. That is, if the environment is so polluted, how can we keep our indoor environment clean and unpolluted?
Can I speak?
Yeah, definitely, Professor Safar.
Okay. So I think in one of the slides I talked about, yes, very good question. Now it is becoming so worse in some of the places like Pakistan and many of the low-income countries that, it has become, challenging to protect oneself from there. And obviously, the indoor air quality is affected by the outdoor air quality. Both are interconnected. So like New England Journal of Medicine has talked about, like, those air filters. If you can afford, it is becoming cheap also because it's not that costly, but if you can afford that, so that's one. Obviously, within the household, smoking and, the indoor sources. So you need to have a ventilation in the kitchens in particular, because those are actually the exposures, but also the secondhand smoke due to smokers inside the house. And the air filters and air conditioners, if you can afford that, those are the potential, solutions. And obviously, planting trees and longer term measures are also there. Thank you so much.
Thank you, Prof. The next question is for Dr. Nargis Khanjani. In areas with poor air quality, should labor laws compensate workers for the illnesses which are linked to environmental exposure to this polluted air?
Well, why not? I mean, if workers are forced to work in polluted air, why not? That is an occupational hazard for them. And that's where we have to get the politicians to realize what is happening, because these are regulations that have to get approved in different nations. But for the workers, the advice that we can give to the workers is at least do not work on days with high air pollution, or work on the hours of the day that there is less air pollution.
Okay. But what will happen to the poor countries where do you think they'll be able to compensate for their workers?
Poor countries are the ones that will be hit the strongest by climate change. That there is no doubt about that. And in the vulnerable groups, remember that we mentioned the poor people. They will be hit by climate change worse than any other country with the world. And that is where we say that climate change is very unjust. It does not affect people equally. In fact, the poor people and the people in the poor countries with weak infrastructure are the ones that are going to get hit more than others.
I definitely agree. I think the biggest polluters are well-developed countries where they'll be able to compensate, protect, and all that. But the impacts are mostly suffered by the low and middle income countries. So maybe we should have some like what they are doing, like a climate fund for the poor nations to deal with the adaptation will be a great effort. Next question is to Dr. Najibullah Mujadidi. Why waste management technique is viable to avoid plastic burning and encourage recycling? Why waste management technique is viable to avoid plastic burning and encourage recycling? I mean, I think maybe the person would have meant recycling of plastics instead of burning the plastics as part of waste management.
Yeah, thank you so much. First, I would like to just provide the information that the difference between developed countries and developing countries, that developing countries are least, I can say
Contributors.
they are very least involved in promoting the climate change, but they are most affected. Regarding to the waste management, unfortunately, in the country, we have a local incineration system, and for the recycling, we don't have a system in such cities like Kabul, Kandahar, and other large cities of this country. So this is going to be a problem, and that's why in our country they are using plastics, and there is no system for recycling. So they're using plastics, words and calls for a heating system. That's why. Thank you.
Thank you. Thank you very much. Next question is for Prof. Safar. With air pollution worsening in Pakistan, what steps can be taken to protect the communities and improve the air quality in Pakistan?
Okay, thank you. Good question. I think I alluded to some of those things in my presentation, but again, so one thing also for clarity, so when we talk about climate change, obviously this is about greenhouse gas and greenhouse gas high income countries and those which are developed are producing a lot of carbon dioxide because of the burning of fuel, etc. And the low income countries are affected by that definitely more because their systems are not developed. But when we talk about the air pollution, which is more of a local problem, means if your industry is emitting particulate matter, that has nothing to do, very little to do with the global climate change. And if your vehicles and industry, your transport is not good, so you're emitting, and so you have to do something in the country to reduce air pollution. The emissions of the global climate change will not have much impact. It will have some impact, obviously, but not much. So you're like, if your waste is not recycled and you're burning, and also in the country, so that will be air pollution. That will you have air pollution irrespective if the global climate change goes away. So your air pollution will remain there. So my thinking, you have to work on your systems, and that includes what systems you have to work. Obviously, the three arms I always talk about. One is awareness, so local awareness. All the people need to be aware of this problem. So awareness translates into policies. You should also have policies like transport policy, population policy, technology policy. So energy policy. So what energy you will use in the country in the next 10 years, for example? Is it the the renewable energy, or is it the fossil fuel energy? So that policy, so the transport policy means, are you going to have good management of your transports? You'll have new cars, the car policy, or you'll have the old cars. You'll not replace the new cars, for example, or you'll have mass transit in your country. So those are the transport policies which will have an impact. Same goes for the industrial policy. What kind of industry will you allow in your country to emit and burn and causes air pollution? So those are the policies. So the second arm is policy. Policy is strengthen awareness, awareness is strengthen policy. The third thing, and this is the service, which I call it service. For example, if you say, I will punish the polluters, or I will punish the emitters, those old cars, for example. So somebody need to measure that. There should be a system to measure that. And once you have a measurement, then you can obviously identify and protect. So you'll have an industrial measurement, then you'll know exactly who is the culprit, and then you can implement the policy. So unless you have the service in place of measurements and regulations, so you just have a policy, but you can't implement it. So you have to have the service part, and you have to have the awareness part, and you have to, so all the three work in unison in order to achieve that. That's my thought. Thank you.
Thank you, Prof. Thank you so much for that elaborative answer. The next question is, Dr. Nargis, it is for you. Someone has asked, when Dr. Nargis says economic loss from the premature deaths in Iran from air pollution, what accounts for this economic loss? Is this from the healthcare cost?
Yes, definitely from the healthcare costs and the loss of people. I mean, people themselves are valuable resources. Look at yourself at this age. You have got to this age, and how much money was spent to get you to this age as an educated person sitting here, living in, living in your hometown and serving the society. You are a valuable resource. And if you get eliminated, if you die sooner, a premature death has a huge economic loss to the society. The society is losing its people, its workers, its youth. And so a person who was supposed to, get a heart attack at 70 and die at 75 is now getting a heart attack at 40. And you can estimate the cost of the medical cost after that heart attack that he has, the big burden that he has to compensate for the rest of his life. Or a young person who is getting asthma at the age of 20 is getting asthma attacks. That's another burden. And then in countries of the EM region, some have good insurance policies, some don't. Some of the insurance have gone broke because of the cost. So all of this is raising the alarm on the economic cost of what is happening. The best thing to do in these countries is primary prevention, as you have learned in public health. In developing countries, they're investing in decreasing air pollution, in primary prevention to prevent these happenings, these things happening.
Thank you very much, Dr. Nargis. I think we are beyond our times. So maybe we will stop the Q&A session. I was not able to address all the questions. So maybe you will be the learners may be able to contact the speakers by the email, and you can have any doubts cleared in that. So thank you very much, all of you, Dr. Nargis Khanjani, Dr. Sahar Fatmi, and Dr. Najibullah Mujadidi, for all the wonderful case presentation, as well as for such an amazing lecture, which dealt with all the aspects of air pollution, as well as on the impacts of health because of wildfires also. Thank you very much. And thanks all the learners for your cooperation and active engagement. Thank you. Thank you very much for thank you very much for the Columbia School team for giving me the opportunity and for conducting this one, which is first in the region, and it is going to benefit many of the healthcare workers to know about the impacts of climate change. Because always we think it is not the duty of us, our doctors, it is the duty of environmental scientists. but it is the duty and responsibility of the healthcare workers. So we need an interprofessional team to deal with this problem. Thank you very much. Thank you.